I want to thank eBella for this opportunity, and I love any organization that supports women. I do have to add that my holistic health coach over there, Karen Callan, also co-created Best Body Now with me. So let's get started. We got a lot of stuff to talk about. Ladies, remember when walking into a room meant turning heads? You had that glowing skin, in-shape body. Didn't you feel sexy and confident? How about your husbands? Remember when you could hit that golf ball down the fairway and watch it go and go? He could play 18 holes and he still had energy to come home and do your honey-do list, or better yet, chase you around the house. Then came postmenopause, and for men, post-andropause. What comes next? Postmortem? I don't know about you, but I'm not ready for postmortem. I want to enjoy my life like it is now. You see people every day like this, walking around, going through the motions like zombies. You may even be one of those women who don't sleep, fight depression, gain weight, are irritable, have no libido. The coveted tea time no longer matters because you're too busy on doctor appointments. You've spent your life getting ready for your retirement, and you can't fully enjoy it. Instead of racing to the bedroom, the only competitive edge you have left is shuffling to the couch to beat your spouse to the remote control. Just because you're getting older doesn't mean you have to feel older. Wouldn't it be great if we can control how we age? Well, here's a news flash. We can control how we age. We really are only 5% our genes. The rest is what we do with them. Yes, you are supposed to go through menopause and andropause. That's a natural part of aging. But then you're supposed to drop dead. Are you ready to drop dead? I'm not. I'm in my mid-40s. I've been on bioidentical progesterone for years because I need to maintain my mental sharpness and lower my risk for breast cancer. I know it's contrary to what you've heard. According to the World Health Organization, the average life expectancy in 2013 in the US is 78. Compare that to 1925, when the life expectancy was just 59 years old. We are living 20 plus years longer, and that's just the average. I have patients who are 85, 87, living full lives. How do you want to spend that extra time? We do preventative care on our car, on our house, even our finances. Why aren't we doing this kind of medicine for our body? You can have preventive medicine, but it's not the kind of medicine you typically get at your doctor's office. In our country alone, we are spending twice as much per capita as other countries who are living as long, if not longer than us. And the money that is spent, 95% of it goes into treating your illnesses rather than preventing them. Patients ask me all the time, well, how come my doctor isn't doing this? Why aren't they doing it? I always reassure them that their doctor is doing the standard of care and everything is appropriate. They just don't have those tools in their medical bag to offer you. Why? Because they had to go to school after medical school and residency. They don't teach us that when we're in training. I love the story. About 5 years ago, I was on a plane ride going to one of my anti-aging conferences, bubbling with enthusiasm, couldn't wait to learn new stuff and network with like-minded physicians. I immediately sniff out that the guy next to me is a gynecologist. We have a way of doing that as physicians. He didn't share my enthusiasm about going to this conference. He kind of seemed, like, what's the matter? Are you excited about going and learn all this good stuff? Ugh, all that bioidentical hormone nonsense. That's for gynecologists who can't perform surgery. So I immediately said, oh, are you one of those gynecologists? Oh, no, not me. I'm going because my wife wants me to go. And there you have it. He wasn't going to treat his wife conventionally. He was going to treat her with bioidentical hormone therapy. As fate would have it, we ended up on the red eye back home. I didn't bother to grab him, but he came running up to me, this time bubbling with enthusiasm. That was the best conference I ever went to. They didn't teach me any of this stuff in residency or medical school. I said, congratulations, you've seen the light. I saw him last month at a conference. He dropped 20 pounds and looked 10 years younger. Do you want all of your hard work to go towards living in a nursing home, taking pills, having surgeries? The money you've saved, you should be able to enjoy your retirement. Why not spend your money, energy, and time on preventing age-related illnesses that we all fear, like diabetes, heart disease, dementia, cancer, bone loss, arthritis? That is what anti-aging and functional medicine can do for you. It's not a guarantee. Nothing is a guarantee. But it's the best life insurance policy and lacks the side effects of prescription drugs. Earlier, I was telling you how we have control over how we age. And controlling our weight and maintaining muscle mass is directly related to how we age. Obesity is an epidemic. By definition, it means that you have a body mass index above 25%. But just figure it's an extra 30 pounds you're carrying around. Look over here at 1997. We only had 3 states whose population had a body mass index. 20 to 24% of the population had a body mass index above 30. Let's look at 1999. The numbers have more than 6 times. Let's fast forward for a moment. 2010, there's no more states left in the blue. So that means every single state has a population with 20% of its population that's obese and much higher. Look at these numbers. These dark reds, above 30% of the population. And unfortunately, 2030 is not looking much better. We're actually projected to double our obesity rates from 2011, not from 1997. That means states like Mississippi, they will have 60% of their population or more will have a body mass index above 30. I'm going to talk to you first about 3 things that are pivotal to anti-aging medicine. First, given the state of our health in the United States, I want to talk about the key role of good nutrition and exercise and how they aid in preventing some of our age-related illnesses. Since time is limited and I'm discussing hormones in a breakout session, I will briefly mention them because they are part of aging. I did it in this order intentionally because I see hormones as the icing on the cake. It's kind of like trying to take an organic heirloom seed and grow it in Florida sand. It doesn't work, and that's why many women don't feel well when they take hormones, because their bodies are too toxic. The things I'm going to talk to you about today will make you feel better so you can take better care of yourself. It's just an overview of what I do every single day with patients and a small portion of what I speak about in longer seminars. Let's talk about nutrition. Nutrition, everybody knows that smoking is a leading cause of death. In 2000, the Center for Disease Control said that poor diet, oops, something got messed up. My slides got a little bit out of whack. Poor diet, inactivity, and alcohol contributed to 485,000 deaths. Compare that to smoking, it was 435,000. Diets don't work, and that's why I don't want to talk about diets. I'm talking to you about nutrition. The U.S. Department of Health and Human Services says 4 of the 6 leading causes of death, things that we are trying to prevent in age management medicine, are directly related to poor nutrition. Vegetables are one of the most important things you can incorporate in your diet. And I'm not talking about veggies as a condiment. When I see patients, most of them say, I've got a great diet, got a great diet. So I ask them, what'd you eat today? It might be 3:30, 4 o'clock in the afternoon. And often they haven't listed one vegetable. I tell them they may have a better diet than most Americans, but they're comparing themselves against a nation that has no idea of what good nutrition is. I'm talking about striving to get a minimum of 50% of your entire diet, not one meal, to be vegetables. And notice I said vegetables and not fruit. I'm not against fruit, but people get hung up on that and they forget about the veggies. Diets high in veggies lower blood pressure, lower cholesterol, help prevent heart attack, and also can help prevent cancers, in particular breast, prostate, and colon. How would you like to eat more and weigh less? Sounds impossible? Well, you can. Chinese population, when matched for activity level with Americans, ate 30% more calories and weighed 20% less. Veggies are the best kind of carbohydrates to eat, and ideally, we want to limit the amount of carbohydrates we get from grains, even whole grains. Why? Because excess grains raise your sugar, sugar clogs your arteries, and clogged arteries cause heart attack and strokes. Here's a picture of a brain. On the left, you see a healthy brain, and on the right, you see a brain that has got dementia. In 2012, the Journal of Neurology showed that people with high sugars have a 50% decrease in the size of their brains over a 6-year period, versus those who have low sugars. The Mayo Clinic said elderly people who fill up their plate with whole grain carbohydrates show a 4 times the risk of cognitive decline. We actually, in functional medicine, consider dementia to be type 3 diabetes. Let's look at osteoporosis. Milk, does it really do a body good? I say no. I say no because calcium from dairy destroys most of the available calcium to the body. Nurses' Health study of over 72,000 women showed that calcium consumption was not associated with lower osteoporosis. The US alone has the highest intake of calcium and yet the highest intake of osteoporosis. Why? Because things like caffeine, salt, sugar, and animal products, even dairy, have high acid content. So the body balances that acid content by leaching calcium from the bones. Veggies can be a great source of calcium. 1 4-ounce cup of cooked kale has as much calcium as 1 cup of milk, and it also has the vitamin K2 to ensure the calcium that you're eating goes to your bones and not your heart. That's all the controversy around calcium and heart disease. Sesame seeds and almonds are also very high in calcium. Protein intake is actually a big predictor of healthy bones. But I just told you that animal protein can actually be acidic and weaken bones. So how are you going to get enough protein? Veggies actually have a lot of protein in them. This is an example of 500 calories of plant-based foods versus 500 calories of animal products. Got the same amount of protein content, just about. No cholesterol in veggies, almost 30,000 beta-carotene, and 31 grams of fiber versus none. I like to use the example of my health coach, Karen Callan, her husband, John Callan, who was a CEO for Johnson & Johnson for many years and had a short stint as a professional football player. So he's not a small guy. Every day while he worked, he had 2 eggs, 2 pieces of toast, 2 pieces of bacon, 2 pieces of sausage, coffee. And he figured that his wife, the holistic health coach, should be making this every day for him at home. That didn't fly too well. She said, I'll make you a deal. I'll make you that as long as you drink my veggie smoothie first. She said it took him 1 week to be full enough and not crave that now he has it once a week after church as a treat. I'm not telling you to give up your meat. Do I think it's healthy for you? I do. But I know that that's not what everybody wants to do. So I need to meet people where they are. Try making veggies be 50% of that plate when you put it down. Choose good meats like grass-fed beef, or better yet, game meat like bison, which has lower cholesterol than all the chicken that you're eating. And for those of you who like lamb, it actually has a very high omega-3 content. Eat your meat with lots of veggies and drink water with lemon in it. Take the food prescription instead of the pill prescription. Eating the right diet will give you the energy for the next things to help you age more gracefully. Exercise. I know, it's a dreaded word, and even though you don't want to take pills, I'm sure you would line up by the masses if you could take a pill and not exercise. They don't have that yet. They've proven that exercise can lower your risk of everything from diabetes to dementia. Think of exercise as your next preventive prescription. I often hear, well, I don't have time to exercise. I can assure you, if you don't have time to exercise, your body will find the time to get the illnesses related to not exercising. And exercising doesn't have to be hard. Start somewhere. I tell people if you could just commit to the pattern of doing it, you can build the time on from there. Start 15 minutes most days of the week. Walk around longer while you're shopping. Park your golf cart when you're golfing and walk to the ball. Do squats while you're waiting for the shower water to warm up. Do something besides hitting the remote control or texting. Walking is a good start, but ladies, it's not enough. You must also include strength training. This not only builds bone, but it builds muscle. And the amount of muscle you have correlates with how healthy and how young you are. It's what makes the difference between being a size 6 and 125 pounds and a size 10 and 125 pounds. No, muscle does not weigh more than fat. Just ask our wealth management people over there. They'll tell you $5 is $5, whether it's bills or pennies. Still makes $5. The difference is the muscle's taking up less room and you can fit into a smaller size. A lot of people are intimidated by weights, and rightfully so. I tell them you don't need to become a bodybuilder. You can start with slow weights, and I really encourage that you work with a personal trainer, particularly in the beginning, so you learn proper form and avoid injury. It also ensures that you're more likely to do the exercises because you made an appointment, just like you do your court time or your tea time. People who've never exercised can still get benefits even after the age of 50. And I love to use my mom as an example. She's 74 years old this year, and about 10 years ago, she was on cholesterol medicines, 20 pounds overweight, basically a diabetic, and had severe spinal stenosis and pain that required epidural injections. We got her to get on our Best Body Now plan, and she started exercising and changing her diet and doing all the things. I gotta do that, I gotta do that. I said, hey, you told me you want me to keep you alive till you're 100 and healthy. You gotta do what I tell you. I said, besides, I'm taking care of you for free. She did everything I told her. She swims now 5 days a week. She's dropped 20 pounds, is off statin medications, has reversed her diabetes, and hasn't had an epidural injection in 5 years. What's her side effects? She has arms like I've never seen. Again, take the exercise prescription instead of the pill prescription. Since we mentioned cholesterol, I need to spend a few minutes speaking about that with regard to heart disease, especially as it pertains to women. I know everybody here is afraid of breast cancer, and rightfully so. But you need to understand that your risk of breast cancer is far less than your risk of heart disease. Heart disease is the #1 killer for women. Your lifetime risk of breast cancer is 12%. Heart disease, 39%. And your risk of dying from heart disease is 10 times that than breast cancer. Conventional medicine is stuck on 5 risk factors for heart disease, and high cholesterol is one of them. Truth be told, there are over 395 risk factors for heart disease. Do you know how many people have normal cholesterol who have heart attacks? 50% of people have normal cholesterol and heart attacks. I had the pleasure of meeting and knowing Stephen Sinatra, and he was one of my professors for my master's program. This is a great book. I recommend it. He uncovers a lot of the truth about the large-scale trials that were done on statins. One of the largest trials was on a Mediterranean diet, and it showed that although between the two groups the cholesterol level did not change, the people who ate the Mediterranean diet had a 76% reduction in heart disease, even though their LDL or bad cholesterol didn't change. Or how about the Nurses' Health Study that looked at 84,000 American women? After all their studies, several years of follow-up, you know what they concluded for the 5 things to lower your risk of heart disease were? Not smoking, exercise, moderate alcohol intake, maintaining ideal body weight, and eating diets with a low glycemic index and high omega-3 fatty acids. Statins were not mentioned. Statins do work, though. We can't dispute the data that shows some of the benefits, but it's not without side effects. And the main way that it works is by lowering inflammation in the body and making the blood less thick. But guess what? You can do that with your food. Trials have called into question the risk of breast cancer and statin use. Women on statins without known risk of heart disease may have less heart attacks, but their mortality rate is the same due to the increased risk of breast cancer. What about diabetes? There's been several studies about statin use in diabetes in women who do not have heart disease. Anywhere from 10 to 50% increased risk of diabetes on women without statins, depending upon the trial. In 1996, our government alone, from the U.S. Government of Accountability, stated, quote, statins reduce cardiovascular disease in people with pre-existing heart disease, but at the cost of a corresponding increase in non-cardiovascular deaths across various trials, unquote. So what is new in the treatment and prevention of heart disease? It's going to surprise you, I assure you. Metals. You probably haven't even heard of it. One of my good colleagues is a cardiologist I went to school with. He hadn't even heard of it. And it was published in the Journal of American Medical Association, a major medical journal. This was a great trial. It was a National Institute of Health sponsored trial, $31 million with 10-year follow-up. And it was run by Dr. Tony Lamas, chief of Columbia University Division of Cardiology at Mount Sinai Medical Center in Miami, Florida. All patients had known heart disease and received standard of care treatment, such as aspirin, beta blockers, statin drugs. Then they divided these people after confirming that they had metals, and they divided them into two groups. One group received chelation, a process of removing metals, and had the option of receiving vitamins afterwards, and one did not. How did it turn out? I say the proof is in the pudding. The results showed a 7% reduction in death, 18% reduction in heart disease if you only remove the metals, and a 26% reduction in heart disease if you added vitamins afterwards. And diabetics who have a huge risk of heart disease, they had a 39% reduction in heart disease. If this was a drug, the pharmaceutical companies would be lining up at my office trying to get me to sell it. And despite the study design, purposely including people with known heart disease, purposely giving them standard of care treatment, and clearly making the endpoints for death and mortality and morbidity related to heart disease, it is not universally accepted by the medical community. Historically speaking, that's how it is with medicine. If you step outside the box, everybody thinks you're crazy. And over time, they come to understand what you are doing. It was like that in the late 1800s when women were giving childbirth, and the rate of puerperal or postpartum infection was great. One physician realized that when he birthed the babies at home, the infection rate was much less than when they were birthed in a hospital. He figured out the reason was because doctors went from room to room examining women without gloves. And that's how they were getting the infection. He was completely ostracized by the community. And yet, how basic is hand washing to preventing the spread of infection? We are in that same paradigm shift now in medicine. And I deal with it day to day with colleagues, and I understand their confusion. If you only look here, you can't see what's going on over here. Of the 395 risk factors for heart disease, do you know what the #1 predictor of how much plaque buildup you have in your arteries? It's your sugar level 2 hours after you've eaten a meal. Over here, if you measure your sugar level at 2 hours and you're less than 87, your blood vessels are about 4 times as big as they would be if you measure your sugar 2 hours after eating, and it's between 124 and 140. The important part here is that these are people who didn't have diabetes. These are people who just had high sugars and high insulin. You may think, I don't really eat a lot of sugar. And many of you eat diets, though, that significantly raise your sugar. Let's look at Cheerios. You know, the one that has no sugar added that my patients tell me is so good for them? That's the red line. This is how high your sugar goes afterwards. The first line, which is line 1, is right below it. It's actually lower, and that's sugar put in water. Why is that? It's because of the glycemic index. How much does that carbohydrate impact your sugar when you eat it? I want to say a word about hormones. I know, I say hormones, you think breast cancer. Or you think you don't need hormones because you don't have a partner and you don't need to have a libido. But the benefits of hormones go far beyond sex, and there's a lot of data regarding their safety. I'm not talking to you about the synthetic hormones and the side effects the media highlights. What I'm talking to you about are natural bioidentical hormones, things that came from plants and look exactly like your body's hormones. And I know what you're thinking. If God wanted us to have hormones in older years, he would have made our bodies like that. Yes, like I said in the beginning, he also had us dropping dead at 59, just 50, 60 years ago. We now spend 1/3 of our life in menopause or andropause, and he's given us the divine wisdom and the natural hormones to make that change. When you lose your hormones, you also lose muscle mass. Every year you're losing muscle mass when you're in menopause. That increases your risk for developing diabetes, heart disease, gaining weight, sometimes and often without even changing your lifestyle or eating habits. It is in part because we don't have your hormones. I will be discussing that more in the breakout session and talking about many of the things that the media is not telling you. In closing, I can promise that if you incorporate these 3 things, such as adding more vegetables to your diet, doing combination aerobic strength training, you will significantly lower your risk of developing the age-related illnesses we all fear. I know you all thought I was going to get up here and talk about every single supplement that you needed to take, but it really does start there. Even without taking hormones, these habits balance the ones your bodies continue to make after you go through menopause. The data always comes back to lifestyle, nutrition. Is it a guarantee? No, there's no guarantees in life. Just like your finances, though, you work with a wealth management company, you get the best information possible, and you make the best decisions that you know how to make. You've worked hard or are working hard right now for your golden years. You need preventive medicine that is truly preventative. That is what anti-aging and functional medicine can do for you. It's what I'm blessed to be able to do every day with patients. Ultimately, you decide how you age. And remember, getting you healthy is my passion. Being healthy is your choice.